the first thing I'm going to do is I'm going to go ahead and I'm going to introduce myself. I'm going to inform the patient of what we're going to be doing and what they can expect. I'm going to answer any questions they may have. I'm going to go ahead and perform my hand hygiene and identify the patient. I'm going to go ahead and have the patient give me their name and date of birth. If they're able to, or if they know it, I will check the wristband with what the patient says. Then I'll also have the parent verify the child's identity and their own identity and check their wristband. Once we have the identity verified and we have our hand hygiene done, we can go ahead and a couple things that we're going to want to note before or during the exam is going to be the child's level of consciousness, if their activity level is appropriate for their age. We're going to want to note any, note that the extremities are symmetrical. We're going to also want to note the child's hygiene. We're going to want to make sure that the child is clean and has been taken care of, or note any issues with cleanliness or hygiene. Once we go ahead and have that out of the way, we can go ahead and we can start with the head. When we start with the head, we're going to go ahead and we're going to check the scalp. We're going to check for hair distribution, lumps, bumps, masses, bruises, any abnormalities. Once we check the scalp, we can go ahead and we can look at the eyes. And when we get to the eyes, we're just going to want to check the to make sure that the sclera is white and the conjunctive is pink. We're going to want to note any abnormalities, any drainage or anything like that, and we're going to want to check perola. We're going to want to make sure that the pupils are equal, round, reactive to light and accommodation. Once we are finished with the eyes, we can go ahead and we can go to the nose. When we get to the nose, we just want to make sure that there's a patent airway, and we want to note any presence of any drainage, or maybe like a deviated septum or anything like that. Then we're going to go to the ears. We're going to check for drainage. If the patient is under 3, we're going to pull the pinna back and down, and then if the patient is over 3, we're going to pull the pinna up and back. And once we have checked the ears, we're going to also want to note the symmetry. We're going to want to make sure that the ears are symmetrical, and we're going to want to know if they are low set or not. So once we have done the ears, we're going to go ahead and we're going to move to the mouth. When we're checking the mouth, we want to look for the mucous membranes. We're going to want to make sure that they're pink and moist. We're also going to make sure that the uvula is midline, and we're going to note the teeth. Make sure that the teeth are appropriate for age. Note if there are any missing teeth, any damaged or cracked teeth. Once we have done that, we're going to go to the neck. On the neck, we're going to check lymph nodes. We're going to check for edema or masses or any pain or discomfort around the lymph nodes. We're also going to check the carotid pulses, but we're going to do those one at a time. After we've finished with the head and the neck, we're going to go ahead and go to the cardiovascular. When we get to the cardiovascular, we're also going to check the pulses in the arms. We're going to go ahead and we're going to check the capillary refill in the fingers. We're going to check skin turgor, and we're also going to note over the chest and the back. We're going to do a skin assessment, make sure that there's no skin breakdown or abnormal lumps, masses, bruises, rashes, or anything like that. Also, while we're doing the cardiovascular, we're going to listen to all of the heart sounds, and we're going to listen to the apical heart rate for 1 full minute. Once we have finished the cardiovascular assessment, then we're going to go ahead and we're going to go to respiratory. When we do respiratory, we're going to listen to, in the Z pattern, the 5 sounds on the front, and then we're going to listen to the back. We're also going to know if the patient is having dyspnea by the use of the accessory muscles or nasal flaring. We're going to note if there's a cough and what kind of consistency the cough is, if it's a dry cough, a productive cough. We're going to want to note all of that. So once we finish with the respiratory assessment, then we're going to go ahead and we're going to assess the abdomen. And when we're assessing the abdomen, we're going to want to listen to all 4 quadrants for the bowel sounds, and we're going to go clockwise. And we're going to want to know any sounds that we do hear that may be abnormal or not expected. And if there are no bowel sounds, you're going to listen to the quadrants for 5 full minutes. When we're also doing the abdomen, you're going to listen, or you're going to look, you're going to listen, and then you're going to feel. So by actually palpating the abdomen before you listen, it can produce bowel sounds, which it's not gonna be effective. So we're just gonna go ahead and make sure that we do it in that order. We're also gonna palpate for any kind of when we do palpate, we're gonna go ahead and feel for any kind of masses or abnormalities in the stomach, any tenderness, any pain. We're also going to want to inspect the shape and the symmetry of the abdomen. While we're also doing that, we're going to ask about urination, their urination patterns. We're going to ask if there's any pain or discomfort while urinating. We're also going to ask about the color and consistency, or the color and the odor of the last urination. And we're also going to ask about their bowel movement. So we're going to ask when the last bowel movement was. We're going to make sure that we get the color, the odor, the consistency of the last bowel movement. And we're going to make sure that we want to ask if they're if it was painful or anything like that for them. So after we do the abdomen and we ask those questions, we're going to move on to the genitalia. We're going to, if there's been any complaints or anything like that, we're going to want to address those. We're also going to want to check for any discharge or anything like that. Now, anytime that you assess the genitalia, you're going to want to perform your hand hygiene and change your gloves. Once we have moved on from the genitalia, we're going to do musculoskeletal. We're going to inspect the color of the skin. We're going to inspect the temperature. We're going to inspect to make sure the limbs are symmetrical. Make sure there's not any pain or any kind of tenderness or discomfort with the muscles. We're going to want to check the joints to make sure that there's not any pain or anything like that. We're going to want to get range of motion. We're also going to want to check the spine for alignment. If the child's able to get up, you're going to want to look at their gait to make sure that they have a steady gait. And if not, then of course you want to provide support to them as they're trying to walk. After the arms and legs with the musculoskeletal system, we're going to, of course, make sure that we listen to or assess all the pulses. So we're going to assess the brachial, the radial pulse. We're going to assess the femoral pulses, the posterior tibialis, the dorsal pedis, the pedal pulses. We're going to make sure that we get all of those pulses and make sure that they are strong and equal bilaterally. Now, after we check the pulses, we're going to, of course, before we leave the room, we're going to want to make sure that if we ask the parents if they have any questions or any concerns, and we're going to address those or answer them the best way that we can. As far as the child, we're going to go ahead and leave the child in the bed with it locked in the lowest position with the side rails up ×2 and the call light in reach. At that point, we could go back to the nurse's station and go ahead and document the results of the assessment.